Hello, today I'm going to talk about colon cancer screening. This is a very important topic, and there's been a lot of concern lately about this because we're seeing an increase in younger patients that have colon cancer. You must remember that most colon cancer cases have no family history of colon cancer. So just because you have no family history of colon cancer doesn't mean that you can't get it. In fact, that's the history in most patients that have colon cancer. So the age of screening for colonoscopy has slowly decreased through the years, and now we're at age 45. So we're recommending patients who have no symptoms, who are of average risk, that is no family history. And family history is considered having a first degree relative who has colon cancer, especially below age 65. So with colon cancer, there's been some speculation why we're seeing younger patients who have colon cancer than we used to. And it may have to do with diet, obesity, lifestyle, and it may have to do with less colon cancer in general because we're doing colon cancer screening in older people. At any rate, there are going to be some younger people that have colon cancer that are below screening age, which is 45, who have no family history. So if that's the case, then that is what is going on today in the United States. In terms of methods for colon cancer screening, the main one that's talked about and the main one I used through the years was colonoscopy. That's where you look at the entire colon after a colon prep, looking for precancerous lesions like polyps or cancer. If they're present, you can remove them, and if it's cancerous or you think it's cancerous, then biopsies can be obtained through the scope, and also the spot can be marked with ink. If the colonoscopy is negative, a 10-year follow-up is recommended if there's no change in family history or no symptoms. Other methods include stool studies. Probably the best stool test that's out there is one called Cologuard Plus. This will detect colon cancer 94% of the time. It will be less effective, perhaps 40 to 70% of the time, in detecting precancerous polyps. So there is a blood test out called Guardant Shield, and it'll pick up colon cancer about 88% of the time. There's also radiologic imaging such as CT colography or CAT scan with colography. This requires a prep, and you'll well get some radiation, but there's also other imaging that may show up. An aneurysm may show up, or a cancer in the kidney, or other things may show up there. The CT colography detects cancer about 90% of the time. Now, all these tests are dependent on the operator, the preparation, the person reading the images in the case of CT colography. So they are dependent upon other factors. That's important to remember. Now, one of the advantages of stool testing is there's no colon prep involved. There's no risks of complications of colonoscopy, which are about 1 in 1,000 complication rate. Now, in colonoscopy, if the preparation is not good, it's recommended that the procedure be repeated and rescheduled at the time that the original procedure was done, rather than just lengthen out the screening procedure. So it would be a mistake to say, oh, we'll come back in a year. No, basically you put down on your codes, if you're the gastroenterologist, that it was incomplete, and then you reschedule it because you need to get a good look throughout the colon. Now, just doing a flexible sigmoidoscopy, which is an exam where you just look mostly at the lower part of the colon, is not sufficient because you're missing the whole rest of the colon. And so it would be inadvisable to tell a patient you've had a negative colon screening, but you haven't checked the entire colon. So that's something you want to keep in mind as well. Checking the stool for blood, since people can bleed intermittently, this is not going to be an effective way to check for colon cancer. Also, blood in the stool may be a late finding of colon cancer, and the whole purpose of doing screening is to pick it up early before there are symptoms. Once you have symptoms of colon cancer, you're in a later stage and it's less curable. So it doesn't do a lot of good to do that to go down that road. So screening, you always have to remember screening means no symptoms, no anemia, no chronic diarrhea, nothing that is symptomatic. Now, some doctors will do so-called screening on people that have symptoms because the reimbursement's better for screening, but that's inadvisable, especially in the case of diarrhea, because you need to do biopsies when you're evaluating a patient for diarrhea at the time of colonoscopy. And sometimes then when the patient comes in later with diarrhea, you have to repeat a colonoscopy with biopsies, and here comes another colon prep. So that's not a good idea, I don't think. So with that, I'm going to go ahead and conclude the talk on colon cancer screening.